My name is Gayle Kurtzman, and on behalf of Beth Tikvah Synagogue, I would like to welcome everyone to our program tonight. I would like to thank our members, Dr. Grill and Dr. Naiman, for their time this evening and for educating our community about COVID-19 and the mass vaccination effort. We appreciate all that you have done during this pandemic and your efforts on the front line. Our moderator for this evening is Dr. Alisa Naiman. Dr. Naiman is a family physician and an epidemiologist. She is also the owner and medical director of the medical station in North York. Dr. Allan Grill is also a family physician and associate professor in the Department of Family and Community Medicine at the University of Toronto. He is the Chief of Family Medicine at Markham Stouffville Hospital and lead physician on the Markham Family Health Team, which has been working on York Region's vaccination effort. We received numerous questions from our audience ahead of this program. And just a reminder that if you have further questions, please put it in the chat and we will do our best to answer them if time permits. And now I'll hand it over to Dr. Naiman.
Thank you, Gayle. I'd like to thank everybody for coming. I know there has been a lot of new information that's become available today, a lot of controversy that's arisen over the last week. And what we are going to do is try to provide you with the best evidence to help you make decisions and to just let you know more about vaccinations. So we thought we would get started first with just questions in terms of how do you access vaccinations. So Dr. Grill, it's very confusing because depending on the region where you are, there's different ways of accessing the vaccine. Let's start off with Toronto first, and then let's move into York Region as we have members in both locations.
Yeah, that's great. So thanks everyone and good evening. Thanks to all of you for coming. So I just before we get into it, I hope that by the end of the evening, you come out of this with two things. One is hope, because I think the light is at the end of the tunnel and hopefully we'll convince you of that before the evening's over. And secondly, you'll have more information, as Alisa just said, of actually how to access the vaccine. So I think Gayle is gonna put in the chat box, and I'll actually open my chat box so I can look at it as well. But basically, so if you live in Toronto, so that would be not York Region. So if you live in the city of Toronto and the various pockets of the city, whether it's North York, Midtown, downtown, etc. What you want to do is there's a website that you can go to. I think Gayle's going to put it in. So the first one, yeah, that's great. So the first one, basically, I won't read it out, but it's the https://COVID-19. So that is the website you can go to. And if you can't click directly from the chat, you can just sort of highlight it and paste it into your web browser. But basically, that's the link that you can use if you have a new health card. So in other words, a green health card. If you still have, sorry, I think I lost you for a second. If you still have the red and white health card, you can't go to that site. Instead, there's a phone number. There's two 1-800 numbers that are listed in the chat. You might have to wait a little bit when you call, but somebody will answer the phone. The other link that Gayle has put in for Toronto, which is the https vaccine.to.ca landing, that's another link that takes you to a page. And if you scroll down, there's actually a bunch of links to various hospital COVID-19 clinics. Some of them are already registering people to get the shot. Some of them are pre-registering you. So all you have to do is go through the list of them. My advice is you should register for as many of them as you possibly can. Some of them, for instance, the one at University Health Network or what some of you might more be familiar with is the Toronto General Hospital. For that one, if you don't have a postal code south of Eglinton, it either won't let you register, or if you do register, you'll be very disappointed when you show up there if they give you a date, because they might not let you get the shot if you lied, if you put in the wrong postal code. Not that you would lie about it. So make sure you read the fine print, but I would try to sign up for as many of those links as you can for Toronto. And if you just, if you go to the site or you have a relative to help you go through it, you can actually do it over the phone with one of your relatives. Just send them the link. They can ask you questions and fill it in for you. There's no rule that you have to do it yourself. get some help, but there's plenty of places to register. We'll go over what the criteria is shortly about who can get the vaccine right now, but that's the best information for Toronto. And then Gayle, if you want to put in the York region information in the chat box. Yeah, so this website will basically take you to the main page in York region. It's the york.ca/COVID-19 vaccine. Interestingly, because I work in York region, I've been to the site so many times. If you just put in york.ca on Google, it will actually take you to a page for York region. And like literally right in front of you, there's this huge red box that says, if you're looking for information on COVID-19, click here. And if you click there, it will take you to this site that Gayle put in. Now, the interesting thing about the York region site is that as of right now, there are 6 mass vaccination sites. One of them happens to be the site that I work at. It's the Cornell Community Center attached to Markham Stouffville Hospital. But the reason why I'm telling you this is that you actually have to go, I would click on each site one at a time, try to register when we go over the priority criteria. Try to register at each one, and if you don't get into one, just try the next one. And each one actually has a different 1-800 number that you can call to get help with. So the point is, you have to be a bit patient with these sites, but if you go to enough of them and you set aside some time in your day to register, your chances of getting chosen for one of these places goes up significantly. Just trust me. I can tell you, York region, we've been running our mass site for about 10 days. The first week, everybody complained there weren't enough spots. The second week, we're actually looking for people to fill the spots. So that's what's going to happen. And for the Toronto folks, there was a mass vaccination clinic that started today, and there's, I think, 2 more starting Friday. Like, we're going to get a lot of vaccine. It's going to come in a big load in the next 2 weeks. So when we go through the priority criteria, for those of you who haven't received it yet, I promise you, you'll be able to get it and it won't be complicated. So we've left those in the chat. If people have questions about that, we can come back to it. But that's the best way you can register. And just like I said, play with the sites, get your family to look at them. It's not as hard as I think it's been made out to be in the media.
Now, is it possible that if you live in York region, you can still use the Central Ontario booking website?
Yeah, so great question. So as of Monday, there was a provincial registration website called COVAX. And in fact, you'll know you're there. We've given the link, but my York region website, like if you go to the York region website, for instance, and I'm going to tell you why Alisa's question is so important in a minute. If you go to the York region website and you click on the Cornell Community Center site, it's actually going to take you to the provincial registration page, which, by the way, Toronto is also using for some of its clinics. It's the same page. Now, what's very interesting is that originally we were told in York region that if you did not have a York region postal code, you could not access the vaccine in York region. That has all changed. So with the provincial sign-up system, there's a 30-kilometer, I don't know what you would call it, but if you live within 30 kilometers of York region, so if you live in Toronto and it happens to be 30 kilometers from York region, and I'm really sorry, I don't know the cross streets where that cutoff is, you can still sign up to get it in York region. So for instance, if my parents were having trouble getting this in Toronto and they live within 30 kilometers of my hospital, I would be telling them to come to my hospital. Now, the thing about York region so far is that my site's the only one, Alisa, that's using the provincial sign up. The other sites in York region are still sticking with their own hospital sign up for the exact reason to sort of protect the people in York region, to make sure they don't get bumped out from a bunch of people coming from elsewhere. So for the Toronto people on this call, again, I don't think you have to worry, because the provincial sign up system that you're going to see through what we gave in the chat is going to allow you to sign up for a bunch of mass clinics that are going to have a lot of spots for vaccine. So again, at this point, and I'll say this message over and over, the quickest place you can get vaccinated is where you want to go. And so as long as the system lets you in, take the spot.
So quite a mess. really confusing, but I think that really helped for people to understand. I didn't even know about this 30-kilometer rule, so I even learned something today. So all those people living at the border along Steeles, they might be able to get the shot earlier. Now let's move into who's going to get the vaccine. So really complicated. Government has sort of changed the criteria. Currently, we're in phase 1. Let's just take a couple of minutes just to go over phase 1, and then let's really spend a little bit more time going into the phase 2 criteria. So let's talk about that.
Sorry, I'm back. My internet sometimes gets a little funky, so I'll try my best here. So I heard the question, everything's good. So for the purposes of this call, phase 1 right now for the people on this call is if you're 80 years old or older. And basically what that means is that if you were born in 1941 or earlier than that, you're eligible for the vaccine. So York Region, for instance, the only members of the public that aren't, and I'll go over some of the other categories, but in terms of members of the public, the only members of the public right now that are getting the vaccine are 80 plus. The same will go in Toronto to start, okay? Now this is for York Region and Toronto at the mass sites. However, in Toronto, if you're age 60 to 64, now again, I won't go the years of birth because it's a bit more complicated. So if you're 60 years old now, you qualify. If you're turning 60 in 2021, you qualify. So if you're 59 years old now, but your birthday is before December 31st of this year, you qualify. And if you're 64 years old now, turning 65, even if you're turning 65 in 2021, but you're 64 now, you qualify. And the 60 to 64 people in Toronto can access a vaccine. I'll explain which one in a minute, at various pharmacies. So there's a ton of pharmacies in Toronto, not York Region, but in Toronto, that are offering the AstraZeneca vaccine, which Alisa and I are going to talk about shortly. And if you're in that age range, you can get that vaccine now at various pharmacies. That includes Shoppers Drug Mart, Rexall, Costco, Walmart. You have to search a bit for it. So if you Google pharmacies, Toronto, COVID-19 vaccine, trust me, it's all going to come up and you can try to get an appointment. So that's what's happening right now with phase 1 in terms of members of the public. Now you'll hear some other stories. So right now we're also immunizing healthcare workers. Okay. A lot of healthcare workers were done earlier, even in like December, January, mostly hospital-based. We're now doing healthcare workers who have community-based practices. So again, Toronto and York Region, they're a little bit at a different pace right now. York Region started a little bit earlier.
So we'll just wait for him to come back in. We'll give him a second. But while we're waiting, York Region did start earlier than Toronto. And one of the reasons is,
sorry, I'm back. I'm sorry.
Oh, you're back?
I'm going to try to close some of the things in my browsers I'm talking about. So the healthcare worker priority, Toronto is a little bit behind York Region, but you'll hear stories now of family doctors, dentists, psychologists. They're starting to get immunized, right? First responders are being immunized. But for the purposes of tonight's discussion with the congregation, if you're in York Region, it's 80 plus. If you're in Toronto, it just started 80 plus, and then the 60 through 64 at the pharmacies. Does that sort of answer the question as a starting point, Alisa?
Right. So I think especially in Toronto, I know that some of my patients who are 80 and over have received their calls and have been receiving vaccines through the Sunnybrook site for a couple of weeks. Same thing also through Humber River. Northrop General has just got their site up and running. Actually, I'll be vaccinating tomorrow at the Seneca site. So people can now, people in Toronto over the age of 80 will be able to access vaccinations. Now, there has been a little bit of controversy, as just an aside, that your York Region Medical Officer of Health has actually opened up vaccinations to other healthcare workers who aren't considered to be high priority, massage therapists, chiropractors. There is some sense among people that why are we vaccinating these people when the greatest risk for actually having complications of COVID is actually your age. Any thoughts about that? He just announced that today. It was on the news at 6 o'clock.
Yeah, for sure. So just to clarify, and this is where, I think this is where, frustration gets caused among the public. So the communication from the task force and the ministry has not been the greatest. They probably could have done a better job with regards to the communication. And unfortunately, it filters down to the public. So if you're not in circles like Alisa and I are, because of what we do for a living, it's hard to know exactly what's going on. So just remember that the way it works right now is that you have 34 public health units across Ontario, and they're theoretically in charge of the vaccine. The problem is they're getting direction from the Ministry of Health. And in fact, there was a bit of a blip today when Premier Ford was being interviewed. He was asked that same question. He's like, oh, I can't believe they're doing that in York Region. But here's the thing, his plan actually outlined 4 categories of healthcare workers. One was called highest, then it was very high, then it was high, and then I just actually can't remember the last category. And basically what was rolled out, what they said is they said around this time, high priority, which would include some of the psychologists and some of the optometrists, would actually be vaccinated. So if you look, there's actually like a chart online where you can look at the various timelines of who should get vaccinated. And it was his plan that actually talked about these healthcare workers. So I would agree with Alisa. Like if I was running the show, I would say that the best way to roll this out is by age. That's sort of how Israel did it. Now, Israel, at the same time that they rolled it out by age, they did do healthcare workers and they did stratify them based on highest risk. So for instance, ICU physicians, emergency room physicians were first, and then they would go down the line from there. So what York Region is doing is actually not going against the plan, but in the eyes of the rest of the public, they're kind of like, well, when's it going to be my turn? I will tell you, Alisa, I had a task force meeting tonight at York Region, so I'm not breaking confidentiality here. And I want you to know that we have actually requested as a health unit to the ministry that we should be opening this up as soon as we can to 75, 70. So, in York Region, we've actually immunized, I think 60 or 65% of all people over 80. We might be at 80% by the end of the week or by early next week. Let's open it up to the other age ranges, but it's up to the ministry. So I'm not trying to throw the ministry under the bus, but I'm just telling you that we recognize that we want to get this rollout as quickly as possible to the older population, which in my opinion, whether you label that as 50, 60, whatever you want, but I would agree with you, as soon as a bunch of the 80-year-old plus are done, we need to shift it down to 75 to 70. So the public health unit I'm affiliated with is trying to roll that out. And I'm assuming if the Toronto mass clinics go as well as they're supposed to, I think Toronto will get through the 80-year-olds pretty quickly as well.
And just so that everybody knows, he did announce that 40,000 doses of vaccine were coming into York Region next week. So there's a lot of supply that will be arriving, and I think everybody will start to be able to access. Now let's shift now, and let's just talk about what to expect when you're going to get the vaccine. This is not the typical go to your doctor's office, go to the pharmacy, get a flu shot and leave. So let's sort of work through the process. And so maybe just touch on some points. Why don't we start with anything that people need to know in preparation of getting their shot?
Yeah, excellent. Okay, so the first thing you want to do when you're registering, is that there are some instructions on the registration site you want to pay attention to. They give advice on what to wear. So for instance, it's still cold outside, so it's okay to wear coats and sweaters, but make sure those coats and sweaters can come off quick and that you're wearing a t-shirt or like a sleeveless shirt so we can get access to your arm quickly, right? So every registration site will talk about that. Most people I've dealt with in York Region at my clinic have been very well prepared, but not everybody reads it. So please read the instructions. Here's what you can expect. So hopefully you won't expect long lineups. And I just want to dispel one of the myths out there because the media loves negativity. They love it. It's what sells stories. So in York Region, not my site, but some of the other ones, you saw the pictures of the long lineups in the wind, in the snow. How can we let 85-year-olds stand outside in the cold so much? And that's true. That was not good PR. And the planning took a couple of days to get going. But here's the thing. Some people like to show up early for things. I can tell you, my parents, they like to be on time, right? My mom especially likes to be on time. So some people are used to showing up for appointments half an hour early. God forbid, I shouldn't be late. I don't want to miss my spot. So you can imagine if 100 people who have an appointment between 10 and noon all show up half an hour early and they see people in line, the natural tendency is they're going to stand in line, right? So the first thing I will tell you is most appointments, you got to be there 10 minutes early max. And I can tell you, if you're a little late for your appointment, they are not going to kick you out. I promise you, it won't happen. So don't show up an hour before. Secondly, if you show up and you get in line and you realize there's a crazy huge lineup and it's more than 10 minutes before, stay in your car. Stay in your car where it's warm. And then once you get closer to the time, you'll go up. There's usually people walking around outside where you can flag them down and say, hey, my appointment's at this time. Am I going to miss it? And they'll give you instruction. But a lot of times people were coming early. And unfortunately, there are still people that are thinking they can just walk in and get a shot, right? So they're not following the rules. And that makes these lineups longer. So if everybody sort of plays by the rules and reads the instructions, hopefully there's not a long lineup. And at our site, I got to be honest, people aren't waiting outside because we have people screening them in the line. And if they're not supposed to be there, they're politely asked to leave. So then you'll enter the site. Second piece of advice, if you're not feeling well, do not show up for your appointment, okay? Your appointment can always be changed. So if you're sick, you want to go get a COVID test, you don't want to actually be going to get a COVID vaccine, okay? So you'll get those screening questions. They'll probably ask for ID, so just you can show your date of birth to verify whatever. And then you'll end up in an inside queue that moves quite quickly. Once you get to the front of that queue, you'll see there'll be a bunch of tables with vaccinators sitting there. These will be doctors, nurses, nurse practitioners, pharmacists. Everybody who's working these clinics is skilled at giving needles. Believe me, if I can give a needle, any of those people can give a needle. Seriously, like doctors are doing a ton of this. Nurses have been doing this far more than doctors. So you'll get put at a table. Somebody will greet you. They'll ask you to take your coat off and have a seat. And for the next, if Allan Grill is doing it, 45 seconds, they'll actually take you through a consent process. And, Alisa, I know some people are going to have questions about this, so I won't give too much away now, but
right.
You're going to get a few questions about your health. They're going to ask you some questions about a history of allergies. They're going to ask you a few questions about whether you're on certain medications, if you've had other vaccines in the last couple of weeks. You're going to answer all those questions. And then they're going to tell you that they're going to wash their hands, put on gloves, they're going to clean your skin. Then they're going to give you the jab. It really doesn't hurt that much. You might get a fancy Band-Aid when it's done if you're bleeding, and most people do not bleed after these shots. And if it is, it's a teensy bit. And then they're going to tell you about the observation area. So after every dose, you have to be observed for 15 minutes. Why? There is an extremely low risk you can have an allergic reaction to the vaccine. The Pfizer vaccine, the latest numbers I looked at, it was like 5 people for every 1 million doses. And Moderna, it's like 2.5. Same thing for AstraZeneca. Like it's extremely low. And if it's going to happen, it's going to happen within the first 15 minutes. So when you're sitting in this observation area, there's people walking around to make sure if you're not feeling well, they'll address it. I can tell you nobody has died from an allergic reaction to the vaccine. And if God forbid you get an allergic reaction, people will be giving you the right treatment right away there. You may have to go to hospital, but I can tell you the number of cases where this happens is so minute. In fact, some people are even talking about getting rid of the observation area altogether, which we haven't done. After that 15 minutes, you end up checking out at checkout desk. You will get your parking validated. Nobody pays for parking for these shots. You'll get a receipt, and then you'll get the date for your next shot, which I will save in a moment because I'm sure Alisa will be asking me about that. And then you go home. Side effects, basically, after the first shot, maybe 10% of people have a bit of pain in their arm. If you feel a little bit unwell, it usually doesn't last for more than 48 hours. I recommend Tylenol to this group, since most of you right now are over 60. I don't recommend anti-inflammatories to older people because there can be some unwanted side effects. So I like Tylenol or acetaminophen. And to be honest with you, most of you will not even know you had the vaccine. That's my whole speech when somebody comes in, and that's exactly what you can expect.
Let's now get down to some examples of, like, on a daily basis, I get calls from my patients Do I qualify? Should I get the vaccine? Does this preclude me from the vaccine? So let's just run through some examples. Let's start off with if you're on a blood thinner. So a lot of people think that if you're on a blood thinner, you can't get the shot.
Yeah, so that is absolutely not true. I will give the vaccine to anybody on one or multiple blood thinners. There are some medical situations where you might be on 2 blood thinners, believe it or not. It does not contraindicate or cancel out your chance of getting the vaccine. Honestly, the only reason we ask it is so Allan Grill can get that cotton ball extra ready in the event that you have a little bit of bleeding after the shot. And I can tell you, I've given this to people that are on every blood thinner known to man in Canada, and I have not had anybody have a major bleed. To be honest with you, I put a piece of cotton ball on for 10 seconds, I stick a Band-Aid on, we're done. So blood thinners, not a problem. They will ask you about it, but it's not a problem.
I actually had the same experience. I was vaccinating in some retirement homes in Newmarket, 2nd doses of Moderna. I was shocked. I thought people were going to bleed. Nobody bled. And they were a high, very old age group. And I'm sure a ton of people are on anticoagulants. So I really think that's not an issue. Now, another one, a big one, is allergies. Okay, so let's break it down to let's start off with people who have, let's say, a food allergy, a penicillin allergy, not anaphylaxis, but just a regular allergy. What about them?
Yeah, and for those people that don't know what anaphylaxis is, and I know it all too well, not just because Alisa and I are physicians, but my son has a severe anaphylactic allergy to nuts as well as soy. So I'm very familiar with the topic. Anaphylaxis is where you get a reaction to something. And as Alisa said, it can be food, medication. Sometimes it's certain materials like latex, insect stings. And your body basically goes into something called anaphylaxis where it almost attacks itself. And you can have a situation where you can actually die very quickly. People need something called epinephrine or adrenaline. It's the medicine that saves their lives. And they actually have to go to hospital to be observed for up to 8 hours. And sometimes they need other medications while they're there. So for non-anaphylactic allergies, so for instance, some people might tell you that if they put on latex gloves, their hands get a bit itchy, but that's it, something like that. So those people are at no higher risk of anything happening to them with the vaccine than anybody else. And Alisa, to be honest, when I'm asking the allergy question, froze again, shoot. Sorry, give me 1 sec. Sorry, I'm back. When I get to patients with the allergy question, my main question is, do you have anaphylaxis or is it severe? So for the minor ones, like you just said, I don't even pay attention to them.
Okay, so now what do you do with that patient who has an anaphylactic reaction to a wasp or a bee or to any kind of medication?
Yeah.
Medication, food, anything.
Yeah.
Common things. People think they can't get the vaccine.
Yeah. So again, not true. In fact, there was a great blog in late February by Alisa and my colleagues in the Canadian Family Physician Journal that really talked about this. And basically, if you have an anaphylactic allergy to something that has nothing to do with the vaccine, like foods or medicines or anything Alisa just mentioned, it does not preclude you from getting the vaccine. In fact, the allergists even say that those people do not need extra observation, that the 15 minutes is the same for them as it is everybody else. Now, just so that you're prepared, you may get a vaccinator that errs on the side of caution. And if they hear that you have an anaphylactic allergy to anything, they might tell you they want to observe you for 30 minutes. And if that's the case, just spend the 30 minutes, don't argue with them, sit there, play with your phone, whatever you want to do, stare at the ceiling. So that might happen to you, but some people will just say sit for 15 minutes. So if you have an anaphylactic reaction to anything, having nothing to anything outside of the vaccine, which is what Alisa's next question is going to be, you can still get the vaccine and your risk is no higher than anybody else.
So let's talk about PEG. So commonly used in a laxative, it's also found in Tylenol. It is the preservative I know that's used in Pfizer. I'm not sure about Moderna. What do people do in that situation?
Yeah. So what they're recommending right now is that if you actually have, and you have to have a known anaphylactic reaction, right? Like some people say to me, well, how do I know if I'm allergic to something in the vaccine? So that doesn't count because we're all in that boat, right? So if you have a known anaphylactic allergy to a component of the vaccine, and the PEG component is actually a component that is given to a lot of people if they have constipation. It's actually a laxative, and it's actually found in a lot of different foods as well. So most people have actually been exposed to PEG and not even know it, and they don't have an allergy to it. So if you actually have a known allergy to PEG, which is extremely rare, or a known allergy to another component of the vaccine, and there's only about 7 ingredients, most of which you would never have heard of, and unless you knew you were allergic to it, you wouldn't even know. What's recommended there is usually we get a consult with an allergist. So you would go to your primary care provider. You would actually ask them to set up a referral with an allergist. You'd have a consultation. And by the way, these allergists can do the consults virtually now. You don't even have to go to their office. They can do it just like we're doing now over Zoom or virtually. And they will decide based on your history, can you get the first shot and you just need 30 minutes observation? Do you need the shot in a more secure environment, like maybe their office? So this is where we need to consult our allergist. I can tell you, I have not sent one consult to any allergist yet, and I've immunized a bunch of people, and I have a fair, decent sized practice. So if you're not somebody who already knows they're allergic to something in the vaccine, you don't have to worry. And if God forbid you have an allergic reaction at the time, it's going to happen when you're sitting in the observation period. Someone will come by, they will treat you. You may have to go to the emerge, and that decision will be made there. Chances are, if it's a true anaphylactic reaction, you'll be given epinephrine and they will be calling 911 to send you over to hospital. But you will be fine. The question I'll just add to what Alisa's saying, because it's probably her follow-up, is what if you have an allergic reaction after the first shot? Can you get the second shot? So again, the answer is you need a referral and a consult from an allergy specialist. In some situations, they may actually recommend you don't get the second dose. And in other situations, they may recommend that you get it under more supervised conditions. I can't answer that now because we're not in that situation, but that's the bottom line. And again, as Alisa said, very, very, very rare. This should not turn you off from getting the vaccine in the slightest.
Now, just a practical point for everybody, just in terms of timing of the vaccine. Nobody knows exactly when they're going, and there is some time restrictions in terms of vaccinating with receiving other vaccinations. Can you talk to people in terms of how much time before, how much time after are you allowed to get another vaccine?
Yeah, perfect. So one of the questions you will actually be asked when you're sitting there in front of the vaccinator, or I should have mentioned before, our clinic is not asking people to fill out what's actually a 5-page consent form. It's really a 2-page consent form, but the government's done in such a way that when you print it at home, it's 5 pages long, and it's not that long. So our clinic is not requiring people to bring that with them. Other clinics sometimes are. You might get an email from them when you have your date. They ask you to fill it out so that when you get there and you hand it to the vaccinator, they scan it quickly and then they just give you the shot. So just be prepared for one or the other. But one of the questions is, have you received another vaccine, not a COVID vaccine, but another vaccine in the last 14 days, a tetanus shot, the shingles vaccine, a pneumonia vaccine, a bunch of vaccines that might be more relevant to this group? And if the answer is yes, they actually recommend that you change the date to getting the first COVID vaccine. Now, why is that? It's not because something bad will happen to you. There's a theoretical concern that your immune system may not be revved up enough to have a proper response to your first dose of vaccine, which is not good, right? You want to get that vaccine so your body's ready to rev up and protect you as quickly as possible. And if it's still revving up dealing with another vaccine, it may theoretically be a problem. So we're actually rebooking anybody that shows up. I've had 2 cases where they've had a vaccine in the last 14 days. We're just actually rebooking them for like 2 or 3 days later. It's a bit of an inconvenience, but it's important. So if you know your turn is coming up soon, I would hold off on other vaccines. There are very few vaccines that you need right now urgently that can't wait until you get the shot. Now, to Alisa's second question, once you get the first COVID-19 vaccine, how long do you have to wait to get another non-COVID-19 vaccine, like tetanus, shingles, all that? The answer is 28 days. So it's 14 days leading up to the COVID-19 vaccine, 28 days after the COVID-19 vaccine. Now, notice what I said though. I said a non-COVID-19 vaccine, because for all those people on this call that are very knowledgeable about the Moderna vaccine, the Pfizer vaccine, it's 21 days, which we'll get to why it's not 21 days anymore, but it's 21 days between doses. So that's because we're talking about a COVID-19 vaccine. Alisa's question was referring to non-COVID-19 vaccine. So you can always space it out. Like I said, there's no vaccine that's that urgent. Also, just for completeness sake, there's other types of vaccines you sometimes get, which I don't think will apply to this group, but God forbid you're exposed to hepatitis B or HIV. There's sometimes a situation where you're given a vaccine or a drug to actually prevent you from getting that condition because you've had an exposure. Those do not count to this conversation. And if you have a question about that, by the way, and you don't remember everything that Alisa and Allan are telling you tonight, don't worry, because the vaccinator person that you're going to be speaking to is going to have all of these answers. So if you get in there and you forget something, they will answer it for you, I promise.
So Allan, we have 20 minutes left. I can't believe how fast time is going, but we all love talking about COVID. So let's sort of move on to like our hot topic issues. Everybody wants to know, let's just dive into the controversy. So there's a couple issues that I think we really should touch upon. One is AstraZeneca. Let's talk about, when we were discussing this before, I would have said, let's just talk in terms of how well the vaccine works. But I think now we really need to talk about clots. And then let's move on to, there's a lot of controversy about when the second shot is being given and sort of the scientific rationale for why there has been these changes. So I'll let you go first. Let's talk about clots and AstraZeneca. Let's try to help people understand the situation.
Yep. Okay. So I'll break it down to 3 parts. So right now there are 3 vaccines available in Canada. There are 4 approved. Okay. Johnson & Johnson was the 4th. Oh, I did it again. Sorry, I'm coming back. Just give me a second. Hang on. Okay, we're back. Sorry, I moved positions. Johnson & Johnson was the 4th vaccine that was approved, but it's just not yet available in Canada. So there's 3 vaccines available. There's the Pfizer, the Moderna, and the AstraZeneca. So let me make this very, very clear. What you tend to hear in the media are these numbers. Pfizer and Moderna are better because they're 95% effective at you not getting COVID. And AstraZeneca is only like 62%. The thing is, those numbers are based on transmission for mild disease. What we're really interested in is, if you get COVID, will you get so sick that you need to be in a hospital or, God forbid, an ICU? And will you die? Those are the 2 things that are most important, because here's the thing. If COVID-19 were a mild disease, just like some of the other coronaviruses out there, nobody would care. But because it puts people in hospital and kills people, we care. So all 3 vaccines in the trials that were done show that they're all over 90% effective in preventing severe transmission where you end up in hospital and you die. So that's why I'm telling all my patients as of March 17th that the best vaccine to get is the one you can get the earliest. So if you're 60 to 64 in Toronto, even outside Toronto, and you can get to a pharmacy in a region where they're rolling out AstraZeneca, you should get AstraZeneca. If you're 80 plus and you're in a region where they're rolling out Pfizer, Moderna, get the Pfizer, Moderna. That's number 1. Now let's talk about the blood clot issue with AstraZeneca. So what they've shown is, in some European countries, specifically Germany was one of the bigger ones, they found that there were some cases, it was actually about 40 blood clots out of probably about 17 million doses that have been given in Europe. And those 40 blood clots tended to be in just 2 or 3 countries, not, by the way, in the UK, that some people were getting blood clots. And it was a signal. So people were saying, are these blood clots due to the vaccine? So in other words, are they causal? Or are they just happening coincidentally because if you take enough people in society of a certain age group, will they just get blood clots? So was it due to the vaccine or just due to the natural tendency of blood clots? Now, here's what's interesting, okay? So in the UK, which has used the most AstraZeneca, they have not seen a signal of blood clots. Whereas in Germany, in Italy, I think the Netherlands, they've seen about 40 some odd cases. And they actually right now suspended giving AstraZeneca in those countries. And so a lot of people out there are nervous. They're saying, well, wait a second, if those countries suspended it, why isn't Canada suspending it? So this is really important to talk about. So what I want you to know is that Health Canada spends a rigorous amount of time looking at these signals. And by the way, these are good things to talk about. I'm glad you're reading about blood clots in the media, because if you weren't, you would wonder why you never hear anything negative, right? Because we're doing all of this post-surveillance data for this exact reason. Is the vaccine or the vaccine safe? Health Canada spends a lot of time on this. And I can assure you that if they felt it was unsafe for you, they would also delay giving it. Right now, based on Health Canada, the National Advisory Committee on Immunizations, and Thrombosis Canada, which is like the blood clot experts of our country, they all feel that the number of cases related to blood clots that have people that have gotten AstraZeneca is actually not necessarily related to the vaccine. There's no evidence to suggest it's causal. Now, what you're also probably asking is, well, wait a second, why don't we just suspend it momentarily like Germany is? And if in 2 weeks we look at more data and we realize it was not linked to the vaccine, we'll just start vaccinating again. So here's the problem. In medicine, and Alisa will tell you this as well, every conversation a patient has with a physician or a healthcare provider is a risk-benefit conversation. And while most people here might be thinking, well, the risk of holding off on AstraZeneca because of blood clots far outweighs any other risk, that's a very big gamble, because can you imagine if we suspended all AstraZeneca vaccinations in Canada for 2 weeks? Do you know what that would do to the numbers of COVID-19? They would go up for sure, which means you're more at risk of getting it unless you're being very careful with hand hygiene and masking and avoiding crowds. We want the numbers to be lower. And so making a decision to suspend vaccination, even though we're only talking about 190,000 doses right now in Ontario, that's a huge decision. And it's not one made lightly. So I'm going to tell you what I'm telling all my patients. I've been getting so many phone calls about this. Right now, it is not we have in Canada, the type of AstraZeneca vaccine, any of that stuff is harmful to Canadians in terms of blood clots or any other, low platelets, bleeding disorder at all. Now, could this change tomorrow or the next day? It could, but something could change with Pfizer as well. And I would never tell you to not take Pfizer if you had that opportunity, or Moderna. The best shot is the quickest one you can get in your arm until you hear otherwise. I have no ties to the pharmaceutical companies. I'm not getting paid to give this talk. My job is to protect people in Ontario, the people I love, people around me, the people they love. Get vaccinated as quick as you can. That is the only way we are getting out of this nightmare.
So Allan, it's actually interesting that you said that. So in Britain, there was 38 people who developed blood clots from Pfizer. There was 11 people in Britain out of 11 people in the UK developed a blood clot, but 11 million doses of AstraZeneca were given. So there seems to be a media push towards AstraZeneca, that there is actually a similar rate of clots. And just to reiterate what you're saying, if you get COVID, you have a 2% chance of developing a clot. So you actually have a much higher chance than even getting a vaccine, even if the signal happens to be true. You're a far greater risk. So if you took 100,000 people in the population, 2,000 of those people will get a clot from COVID, and 0.6 will get it based on the rates that are happening right now in the EU. Now, let's now move on. Tons of controversy. People are really upset. They want their vaccine. They want their second dose. They do not want to wait 4 months. Please help people understand where this evidence is coming from.
No, for sure. And I just want you to know, and I don't want to call out my parents. I love them dearly. I want you all to know that I have this conversation with my parents. I've had it multiple times. So you are not alone if you think that you're frustrated that if you've gotten your first shot or you're about to get your first shot and you don't get the second shot when it was originally planned. I understand your frustration. I do. I don't think you're crazy to think this. So I want to acknowledge that I'm empathetic to your position. Here's where it came from. So here's what we know. In a perfect world, where we had enough vaccine supply. Anyone that gets the Pfizer vaccine, the first dose, should get the second dose 21 days later. Anyone that gets the Moderna vaccine, first dose, should get the second dose 28 days later. The AstraZeneca is interesting because in the trials, some people got it 4 weeks after the first dose. Some people got it up to 12 weeks. So the range is a little bit easier to digest with AstraZeneca because of the trial. Now, when you get your first shot, do you have any protection whatsoever? So the answer is yes. So what is being speculated based on the real world data that we have is that about 3 to 4 weeks after you get the first dose of any of those vaccines, you're probably at about 50% protected against COVID-19, which is better than zero, but it's not perfect. Some of the data from other countries that have delayed the vaccine believe that even longer waiting time, like let's say up to 3 months, you might even have a 90% protection rate. What we don't know is at what point does that wane? We just haven't been doing this long enough. Now, why did the National Advisory Committee on Immunization, which is a Canadian organization, tell the provinces that we should delay the second dose? So here's why. So if you look at countries like Israel and the United States, even the UK, that have done a pretty decent job so far of vaccinating a lot of people, what it's shown is that the more people that get vaccinated, whether it's 1 dose or 2, the quicker you see drops in the daily case counts. So what we're banking on here is that if we can get more shots, first shots, into more arms quicker than letting everybody who gets the first shot get their second shot, as a society, right? Tikkun olam, as a society, we will be better off than if we continued along the same recommendation that we had in the clinical trials. And by the way, is some of this guesswork? It is, but it's based on a couple of things. One, it's based on, as I said before, some real world data from other countries. But number two, there are tons of vaccines out there that we know just from like immunology data that if you delay the booster dose, you're okay. I'll give you some examples. If any of you have ever traveled, Twinrix, hepatitis A and hepatitis B shots, you can delay one of those doses sometimes beyond what's recommended. And the public health unit doesn't make you restart it. You just get the booster there, right? So there is that protection. Now, why 4 months? 4 months was because of our vaccine supply. Now, you can blame whoever you want on that. You can't blame me. But we have a supply problem. And until we get more supply, we need to get into more arms. There is a possibility that with more real world data, those of you that have already gotten the notice, if you've been lucky enough to get your first shot, that your next one is 4 weeks away, that could change. It could be 3 weeks, sorry, not weeks, months. It could be 3 months. It could be 2.5 months. This is a moving target. But the theory is, if you love thy neighbor, you will want your neighbor to get the same shot you get right now. And then when we reach the 3 month or 4 month mark, and then we all give more people the second dose, we can start doing some of the things that I think Alisa's about to ask me about in terms of restrictions. So hopefully that answers the question, Alisa.
Right, and somebody put in the chat that they wanted to know a study. So there was a study in the Lancet specifically looking at AstraZeneca, that after 6 weeks after the first shot, the rate is not 62.1%. It goes up to actually 76%. But the number that has to be quoted by Health Canada is that 62.1%. And that if you actually wait for that second shot to 12 weeks, you're going to actually get a double immune response with the booster dose, as opposed to getting it at a shorter period of time. So there is science behind this. Some of it is exactly what Allan says. We need to get as many people as possible to be vaccinated. But I think as more vaccine comes in, it will become available. Now we have a couple of minutes left, and we really wanted to focus on what do we do? Pesach is coming. People are getting vaccinated. Some people aren't. Can you see your family? What should you do about the Seders?
Yeah, I'm going to answer that. There was one quick thing I noticed in the chat that was a good question. The question was, if I get vaccine like Pfizer first, does that guarantee that I get the same vaccine second? Excellent question. The answer is, as of right now, yes. Whatever your first dose is, your second dose will be. But again, things might change, right? So if for some reason we find, and like I said, I don't see this happening, we find that with more data, a second dose of a type of vaccine you didn't get is better, let's say at the new variants, than what was happening at the time you got your first shot. There's a possibility that will happen, but as of right now, that isn't the plan. Okay, let's talk about Pesach and what to do.
And then if we have time, let's come back and talk about the AstraZeneca over 65.
Oh yeah.
But let's cover Pesach first.
Yeah, no problem. And by the way, Gayle, I'm happy to stay a little bit longer if Alisa has some other questions she wants to get through. I'm respectful of people's time, but I'm happy to stick around for a bit. Okay,
sure, so that would be great.
So Pesach and what do we do? Okay, so there was a great set of guidelines that gave me a lot of hope last week that was released from our neighbors to the south, from the Centers for Disease Control, basically telling people once you're fully vaccinated, and by the way, what that means is aside from Johnson & Johnson, any vaccine that has 2 doses, fully vaccinated means you get your second dose and then you wait 2 weeks. For Johnson & Johnson, I think it's 1 dose and 2 to 4 weeks later. I'd have to check. So the CDC basically came out and said, because we're doing so well in the States at getting people vaccinated with 1 dose, once we roll out the second dose and you're fully vaccinated and you wait 2 weeks, they're actually saying that vaccinated people can get together with other vaccinated people indoors, no masking. Vaccinated people can get together with non-vaccinated people who are low risk, and there's a few definitions of what that means. And vaccinated people also, once you're fully vaccinated, they even made recommendations about, would you need a COVID test if you get symptoms? So this was very hopeful information about what to look forward to when you're fully vaccinated. Now, that comes out, and what happens to people like myself and Alisa? People that are visiting us for their first dose, they sit down in the chair and they say, hey, doc, now that I'm getting this shot, can I go to my grandkids' house tonight? Can I have them over for dinner? And so there's been a lot of miscommunication about how safe things are. So I've stressed one thing tonight over and over. I'm going to stress it again. Your best shot is the quickest one you can get. The second thing I'm going to emphasize over and over again tonight is don't just hang in there a little longer with the public health measures, okay? So if you get your first dose, it doesn't mean you can change things. I am fully vaccinated. My parents were lucky enough to get their first shot. I am still not going inside their house. I'm going to visit them. I'm taking their grandchildren to visit them. These visits are done outdoors, or they're done with them standing in their doorway, depending how cold it is. I'm 6 feet apart. I walk my dog with my father. He just, walks a few feet behind me. Like, I'm still doing the things I've been doing for months, even though I'm fully vaccinated and they have 1 dose, because until you're fully vaccinated, it's still unclear. Can you carry the virus? Can you still transmit it to somebody else? What does 1 dose give you? If it gives you 50%, that means you're 50% susceptible still if you're exposed to somebody else. So people don't want to hear this. People are tired. There's pandemic fatigue. I get it. But the best thing you can do right now is just hang in there. You've hung in there for a year. 3 more months isn't going to be so bad. Now, Pesach. I can tell you what I'm doing. We are not having Pesach indoors with families outside our immediate household. So I will be hosting a Zoom Seder with my parents, my in-laws, my sister and her husband, my wife's siblings and their better halves, some friends. This is all going to be done through Zoom. Now, could you have a Seder outside where you're maintaining 6 feet distance from everybody? Theoretically, you could do it, but here's why it gets complicated. You've got food, you're going to be eating. People like to talk to each other. They're going to get up. It's not worth taking the risk. We're not doing it. I don't recommend you guys do it. I don't think the rabbis and the synagogues are going to recommend that people get together during Passover. So, last year we all wished next year Seder with each other. We're close. We're not quite there, but I think we're going to get there very soon. And I will tell you that if you're feeling sad about not seeing people, Remember, doing things outdoors in small groups, the risk of transmission is very low. You can go for a walk with your grandchildren, okay? If you feel more comfortable wearing a mask outdoors with them, that's fine. You can sit 6 feet apart in your backyard as the weather gets better. The chances of transmission in those situations are very low, but continue to wash your hands, continue to avoid crowds. Don't go to places that aren't essential. You will thank yourself when this is all over and you look back on this. You will thank yourself for taking that little bit of extra time for all of us to stay safe. So Alisa, I hope that answers that question. If you want to add something, by all means.
I think you summed it up very well. It's too risky right now. We've made it this far. Just hold on. Some quick
65
question.
AstraZeneca?
Hmm?
You want to do the 65 in AstraZeneca?
Yeah, no, there was a quick question I thought you could quickly answer. It has come up a couple of times, I know for my patients. If you've had COVID, when can you get the vaccine?
Great. Okay, that's a great question. So early on, believe it or not, before the vaccines were being rolled out, you might have heard the 90-day thing. So people were saying you should wait 3 months after you've had COVID to get the vaccine. And at first we all thought there was some scientific thing where if you got it before 90 days, it wouldn't have the same effect. That actually wasn't the case. What's been shown through antibody studies is that if you've been infected with COVID, you're actually protected for about 90 days after from getting it again. And by the way, the number of people that have been infected twice with COVID, like you hardly hear about that. But for 90 days, it's believed you're protected. So the reason why that number came up is they were worried early on that if we had a vaccine supply issue, the people that have had COVID, let them wait 90 days. We basically scrapped that. If you've had COVID and you are past what we call the isolation period, which for most people is 10 days after the symptoms began. And by the way, that period has to end at the end of those 10 days. Sometimes it's 14, depending on whether you've been tested or not. But you have to be asymptomatic at the end of that time period. So if you get to day 14, let's say, and you're still hacking a cough, no. So once you reach that time period and you've no symptoms left from your infection, you can go get the vaccine as long as you're in the priority group at the time.
And interesting that they're actually doing some work to see that if you've had the vaccine, I know with AstraZeneca, that if you've had COVID, that you might be okay with just having one follow-up vaccine, that there's actually one vaccine that the second dose adds very little to your immune response. So it might be some interesting science that's going to evolve over the next couple of months for that subset of people who've actually had a COVID infection in terms of how many doses they do need. So now with anybody who has time to stay, let's just talk about what happened with AstraZeneca. How did we get here? All of the controversy about the under 65, the over 65. Let's just start off with where this first comes from in terms of the study. Probably will be a good starting point to explain how there's all of this confusion.
For sure. And, Alisa's been not only an amazing moderator, but she is very well versed with the study data. So if I leave anything out, she's going to follow up with it for sure. So the AstraZeneca studies, when they were done, if you look at the original clinical trials, the number of people over 65 in the trial was not high. And so when the National Advisory Committee on Immunization, which is like the Canadian body of experts, very smart people, looked at the data and made their recommendation to Health Canada, they said, even though the vaccine is safe and can be given in Canada, they originally said it should only be given to people age 18 up until 64, like 64 ending December 31st, 2021. So that was the first recommendation. Now, remember, that recommendation was done at the same time where the UK said, no, this vaccine is safe. We're going to give it to everybody who wants it. Now, again, they prioritized it based on age in the UK, but they were using AstraZeneca in people over 65 from day one. There were no safety concerns whatsoever. That original decision about the 18 to 64 in Canada had nothing to do with safety. It was more about, is this vaccine going to be effective in people over 65? So NACI gave their first statement. Now this week, they changed it. They said, now you can give AstraZeneca to anybody you want, including over 65. Why did they do that? So this is the difference between what we call clinical trial data and real world effectiveness data. So we would be irresponsible if we didn't see what happens to people that we vaccinate during a pandemic once they get the vaccine, similar to what we talked about before with blood clots. There are organizations, including the drug companies, that are monitoring all these adverse events. In fact, Alisa and I have to painstakingly fill out this form, this AEFI form, adverse event following immunization, if somebody we know that we've given the shot to actually has one of many reactions. And we have to send that in to a governing body so they can monitor these things. And so NACI looked at the real world data, a lot of it coming from the UK. And when they looked at that data, both the safety and the efficacy of the vaccine, they said, you know what? We got it wrong the first time. Now we have more information and we're going to change our decision. And I want you all to know something. This is really important. This all depends on how you look at the glass, the half glass of water. Do you look at it half empty or half full? I like to look at it half full. Why? Because in medicine, I'm learning every day of my life. In the pandemic, I'm learning every hour of my life, unfortunately. But one of the things I love about medicine is what I'm telling you about osteoporosis this year, it's probably going to change next year. What I'm telling you about how to treat cancer this month, it's going to change 6 months from now, right? That's how we evolve as a science. There's no difference with the vaccine. When we see how it's being used on the ground and these countries are painstakingly collecting this data, that's how we should change decisions. In fact, don't be surprised in 2 weeks from now if it turns out the blood clots, like Alisa and I believe, have nothing to do with the vaccines. Don't be shocked when Germany, Italy, the Netherlands, and all those other Eastern European countries say, we were wrong, we're going to start vaccinating again. The media may not talk so much about it, but don't be surprised. So this is a moving target. We're going to tell you what's the most up to date. And as of right now, if the pharmacies, and I haven't heard this yet, Alisa, you might, but if the pharmacies tomorrow in Toronto and the other parts of the province say, okay, now, not only if you're 60 to 64, can you book AstraZeneca shot, if you're 60 to 79, right? And this is before we get to April 1st, where they're supposed to open this up to 75 plus. I would recommend that all of you who are in that age range, go and get the AstraZeneca vaccine. Now, we don't know yet what's happening with the pharmacies. I think we'll find out soon. There's also limited doses and they've booked a lot of people. But this is why things change. We look at the data and we shift lanes. And if we have to shift back, we'll shift back.
So does that explain, I guess it sort of doesn't make sense. People who are 60 to 64 are getting this AstraZeneca, and a lot of it has to do with that we've got to use up this supply before April 1st. What's going to happen now? They didn't announce it today with opening it up to available to people over 65. Should we now prioritize people who are in the higher age groups to get it over the people who are 60 to 64? It's an interesting question.
That is a great question.
Luckily, we're not in policy.
Yeah. So my answer to that is, I'm gonna cop out here, Alisa. The answer is, it's always harder to pull back than it is to add. So I would say that if I was making the decision as of all the information I have right now, I would say starting tomorrow, if supply allows in pharmacies, you should be able to book if you're 60 to 79. Anybody who's 80 plus, you might as well book for the Pfizer that's going on in the sites, because that's what's available to you now. And it'll be very interesting what happens come April 1st. So on April 1st, if they open up all the mass vax clinics to 75 plus, are we then going to say you get to choose between AstraZeneca and Pfizer? To me, that would be a nightmare, because then the more choice you give people, the more stress they get. So what I think hopefully they're thinking about, and those policy tables that you and I are not a part of, is that they're thinking, let's offer AstraZeneca to the group that's going to still be waiting longer to get Pfizer, Moderna than what's coming up. And that way it's more shots in more arms as quickly as possible.
And what about, I think we touched on it a little bit, but if you get one vaccine, what are you getting for the second vaccine?
Yeah, so right now you're getting the same one. And like I said before, unless we find out something about these variants of concern where it says, okay, you know what, we thought that, I'm just making this up, we thought Moderna was was okay, but now Pfizer is better against the variants. We'll give them Pfizer, which again, I'm totally making this theoretical. There's a possibility we might shift gears, but right now, there is not one expert that I've listened to or read about that is suggesting that. And so time will tell. There was another question in the chat about where are all these vaccines being produced. It's a good question. And it depends on where you live. So I can tell you right now that the AstraZeneca batch that we have in Canada is not the same batch that they got in Germany. So, you know, if you read enough about where we get vaccines, it'll tell you. But I can assure you that Health Canada is not going to allow any vaccine that comes from any manufacturing plant that's not on the up and up. And, you know, all of our biases aside, like, I still trust the Canadian government. Like, Health Canada has no incentive to inject Canadians with something that is unsafe. Like, it will just create so many problems that we don't need. So if it's available, it's safe.
So we're coming to an extra 10 minutes. I want to thank you for taking the time to stay. I always like to end things off with, what's our take-home message? What's the one thing that you want everybody who stayed on the call for? What's the take-home message for everybody?
That's great. Okay, so the take-home message.
Putting you on the spot.
No, that's good. You know, there's a trick I've learned when I give talks to people, and I'll just let everyone on the secret. The trick is, when you start a talk, tell people what you're going to tell them what you already told them. So if some of these messages sound the same, I do apologize, but here they are. Hope is within sight. The light is at the end of the tunnel. Even with these variants, we know that in countries like Israel, the United States, the UK, that are a little bit further ahead than others in getting the number of people vaccinated, we know transmission is down. We know hospitalizations and deaths are down. There's no reason to believe that isn't going to happen here. It's just a matter of us getting the shots into those arms as quickly as possible. So believe me, hope is there. You know, will we get to a point in the fall where we throw everything away and life is completely back to normal? I don't think so. But will we get to a point where the restrictions are way less if we actually roll this vaccine out properly? I'm going to confidently tell you my answer is yes. So number one, hang in there. Don't give up hope. Number two, continue to listen to your public health unit. Wash your hands, avoid crowds, mask when you're leaving your house, physical distance with others. Do things outdoors as much as possible, all right? And avoid going to places that are non-essential. I can't stress that enough. I know that you've got the gray zones, the red zones, the green zones. Aside from those zones, if you want to be, it is better to err on the side of caution and be more cautious at this point of the pandemic. The third thing I will tell you is that we are getting a lot of vaccines in the next month, a lot. And for the people that are members of Beth Tikvah, most of you tend to be on the more wiser side, so over age 60. Your time is coming very soon. And like I said, if you get the opportunity to get one of the 3 vaccines available to you, take it, seize it, grab it, get it done, because that's what's going to help us. That's what's getting us out of this thing. There's nothing else that's going to get us out of it. That's how we're going to beat COVID-19. And the final thing I'm going to leave you with, which I didn't mention yet in this call, but it's really important. Mental health has taken a huge hit during this pandemic. Alisa and I are seeing it in our offices. We're seeing it among colleagues. We're seeing it in our own families. And, you know, I get a bit emotional with this, but this has not been easy for all of us. So be sensitive to people, be kind to them, be understanding if people complain, because you know what? You have the right to complain. But the only way we're going to get through this is through collaboration and cooperation. And so if we all take a positive attitude, we ignore the haters, we ignore the negative media that sometimes gets in our head, we are going to get through this. Because when this is over, the media is just going to find another negative thing to talk about. They're not going to care. And believe me, the media has been quite responsible about getting you information, but there's a lot of negative stuff out there. And Alisa and I are keeping a very positive attitude. We need it for our patients. So again, be kind to each other and have hope.
I think that was well said. And your emotion is just so, it's so nice to see that with everything you've gone through, that you're so not burnt out. And I want to just thank you so much for all. I actually know how busy you are because we both have a call on Thursday at 8 o'clock in the morning. So thank you for everything that you do. Thank you so much for taking the time to educate our community about the vaccine. And maybe there'll be more people will want to do it again, and we can do this all over again at another time. Thank you, Allan, so much.
Thank you, Dr. Grill, Dr. Naiman, for this informative session. Perhaps, yes, we should do this again in 2 months and update everyone with the new science and the new developments. Thank you so much for all that you guys do in fighting this pandemic. We really appreciate all your hard work. And hopefully one day we'll all be together again and we'll celebrate. So thank you everyone for joining us. Thank you for all the questions. We tried to get to everyone's question. We just had so many, so hopefully we answered many of them. Thank you guys, thank you.
Good night, everybody.
Good night, good night.